I never expected that this day would come, that we would actually walk out the door and be forced to walk out the door.
Hi, I'm Shannon Burkett. I'm a registered nurse and certified lactation consultant. I work both at NYC and at Mount Sinai on the Upper East Side.
And my name's Christine Scheinman, registered and certified NICU nurse, also a lactation consultant. I work at New York Presbyterian full-time. I've been there for 21 years in the neonatal intensive care unit.
Thank you so much, both of you, for being here. So from your perspective, can you just tell me why you're on strike?
Every 3 years, our contract expires.
Right.
And so the hospital has to have a proposal, the union has a proposal, and usually they mediate, go back and forth.
It's a give and take,
Yeah.
usually, right? But this year, it was more all take from the management side, not a lot of give at all. Like I said, I've been there 21 years. I never expected that this day would come, that we would actually walk out the door and be forced to walk out the door, because what's going on is the 3 hospitals, Mount Sinai, Montefiore, and New York Presbyterian, are all part of the Greater New York Hospital Association. And they are talking together as a team, trying to basically gut the entire healthcare benefits that we have, which is not just for these 3 striking hospitals, but for any hospital in New York State that is part of NISNA and in our, what we call our benefit fund.
For people who don't know, what is your current health care like?
We actually, it's negotiated that we do not pay into our healthcare benefits. The hospital pays the full cost of it, just as they do with cops and firefighters.
That's great. So basically you have a salary, and then on top of that, the hospital pays for your health care, right?
Yes.
And it sounds to me, correct me if I'm wrong, like the hospitals want to change this.
Yes.
Correct. So if you sign this contract, they can decide whatever fee is correct for them. I mean, how are you supposed to agree to a contract where you don't know how much money they're taking out of your salary? Not only that, I do also want to mention too that nurses are constantly exposed at work. So having this coverage is important because we do put our physical and emotional and psychological selves on the line every day when we go to work.
You mentioned other pillars of this agreement as well. Can you go through them one by one and just state what the nurses union is asking for?
I can speak to safe patient ratios. That literally means that there's a grid that says you have to have this many nurses on a floor if you have this many patients, so that nurses are not overloaded with patients and are unable to properly care for them. I have worked 14 hours without anything to eat or drink and only going to the bathroom once.
And that's because there was nobody to relieve you. Is that correct?
You have so many tasks. You have so many medications to, like, necessary life, like their life depends on it. Their pain control depends on it, medication. You don't have time to go to the bathroom. You don't have time to eat because no one on the floor is taking a break.
And that would be alleviated by having more nurses present?
Correct. When I worked in the neuro unit, we did a protest of assignment almost every single night.
So basically, almost every single night,
yeah.
You had to say, we're understaffed and we need help.
Exactly. Yes.
For how long?
I worked in the neuro unit for a year.
So for the entire year
Yep.
in the neuro unit.
It was almost a nightly occurrence.
Almost every single time you worked, you did not have the help that you felt you needed to provide the care you needed, that these patients needed.
Yeah. And which can lead us also into workplace violence, because I also experienced workplace violence in the neuro unit as well.
Because patients who were frustrated by not getting the care they needed would act out, or?
Yeah. One instance, I was grabbed and wrenched. There was another patient that I needed to clean in order for surgery. And we had to just kind of go in and swipe and quickly go out because he was trying to, hit and kick and bite us. This doctor was over 6 feet. And when we left the room, He burst into tears. The doctor burst into tears.
Right. Do you feel like having more staff would have helped that situation?
Absolutely.
So there's staffing levels, there's health care costs, and what was the other main pillar?
Workplace violence.
Workplace violence.
So there's been these kind of very disturbing cases of violence in the ERs, right? Specifically ERs?
Yeah.
What is the specific ask that the nurses want, or what's the point of contention between the nurses and the hospitals with workplace violence?
It's to have protections in place to enforce greater safety measures in the hospital to protect the bedside nurse. Violence can even happen in the neonatal unit. I've seen it myself. I mean, it's not as common as it would be in an emergency room, but parents can get agitated over the care of their child. Things can escalate. So they want better language in the contract that actually helps to protect the nurse. You might have seen it on social media or people's signs that they've been holding up. Like if you're a fireman and somebody goes after a fireman, that person who goes after the fireman gets arrested. And then if it happens to a nurse, management will turn around to the nurse and say, what could you have done better? Or what could you have done differently? Like it's our job to de-escalate the situation.
What are the specific asks? Is it for more security guards, better training for the security guards? What would the actual change be?
We need metal detectors. We need more security. And specifically, we could use the security level of somebody who is trained to deal with the level of violence that we endure at a hospital and the sort of threats such as knives, guns, things like that. We have many wonderful security guards, but they, like us, are also understaffed. Like there isn't enough to face the threat of now.
So I've heard it from your perspective of what nurses are looking for. So every 3 years there's a contract, so it needs to be renegotiated. This year, the nurses said we would like more staffing, both in security and more nurses, and we want to maintain our healthcare as it has been. From what you understand of the hospital's perspective, what are they hoping to change?
Their main thing is saving money.
Mm-hmm.
That is their number one goal. There has not been any negotiations since it's been a week.
Yeah.
It'll have been a week tomorrow.
So there have been absolutely no negotiations.
At least I can only speak for New York Presbyterian, but there has been none. I think Monty and Mount Sinai might have met on Sunday, if I'm correct.
So administration has said, here's our proposal, take it or leave it?
Yeah, basically.
Yeah. There was no counter proposal. So it's like I said, it's a give and a take. So you give an offer and then management takes it, thinks about it, comes back to the table, decides what their counter proposal is going to be. And it just keeps going back and forth. And now that's been going on through a mediator.
But from what I understand, though, since the strike started, the mediator has just been sitting there.
Right. Trying to get management to come to the table. And the union is ready to go whenever they are ready.
The New York Times has an article that says nurses are making like $165,000 and they want $225,000 a year. So it would seem to me that the New York Times has a very different perception of reality than you do. And I'm just wondering why.
This strike has completely disheartened me in terms of the regular news outlets. I put on Channel 4. CBS had an article this morning, and it was a spokesperson from, they don't say who it is, but New York Presbyterian, and they quoted what the average salary is and that they're some of the highest paid nurses in the city. And it is a blatant lie what is coming out there. Like, I am so disheartened by that. But then when I go to TikTok or watch an influencer on Instagram and they're saying our story, like, and they're interviewing nurses, I'm like, that's true. That's true. That's actually true.
Yeah.
But what is being reported in these papers is not.
You have your article and then you have the comments section, and it was like, and I could see how upset people were. They were like, how are nurses asking for, over $200,000? That's ridiculous. And I'm like, yeah, that is ridiculous, but that's not what we're asking for. So I as a subscriber, you can make a comment. I made the comment.
Just very
never came up, made the comment again, never came up, saw other comments
Oh,
come
you
up.
mean you submitted a comment
Oh,
and
yeah.
it was filtered out?
Yep.
And
Yeah.
it did not show up in the comments?
Nope.
Have you tried writing the author of the article?
I did send a letter to the editor.
And did they respond?
No.
So your trust in the press, which is very important, has been completely eroded.
The wealthy are protecting the wealthy, and workers' rights are somehow a threat to extreme wealth. It makes you really question the integrity of these institutions.
Can we talk about what does victory look like to you? What is getting you really excited right now? I didn't know much about the picket lines going on right now, but I will say when I walked by, everybody seems fired up but joyous. And I was kind of surprised because I thought I was going to see a lot of really angry people, but I just saw a lot of like hugging and crying and smiling. It feels like the nurses feel like there's some sort of momentum and wind at their back.
My old mother-in-law said to me, "Why does everybody look so happy on the picket line? Isn't it hard? Like, you guys aren't getting paid. You're not making money." I'm like, "No, I know. It's deceiving, but we are all fighting for the patient. That is the number one thing. The biggest win is going to be really we're there for the patients. There have been patient families that have come out onto the picket line with us. They're there with us. There was a mother whose baby was in the NICU with us for 6 months and passed away. She's out there on the line with us because she knows how important that care is. That is going to be the big win. The big win is really going to be to have safer patient care. It benefits the nurse. It benefits the patient. You need nurses. You need healthy nurses to take care of the sickest patients in the city.
If we win, then we're hoping that the ripple effect will be felt and others will also have the strength and the courage to go out on the strike line to fight for their right as a worker.
We do not give up easily. It is day 10 of this strike, and we are out there in force in the bitter cold to do what's right and to get what we need.